Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii Elections Guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.
Well, aloha and good morning, Hawaii. It is Wednesday, August 12th. I'm Ryan Kalesuji along with Yunji Denise. This is Spotlight Hawaii, a broadcast brought to you by the Office of Elections. And of course, Spotlight Hawaii, we are spotlighting some of the issues and newsmakers that happen in our community. And right now, we're all about COVID-19 once again as we continue on in this discussion as we battle through this pandemic.
Right. We were supposed to focus this month on the economy. Everything intersects with COVID right now. And someone who's making a lot of decisions about what should happen next and how to best proceed, of course, is Lieutenant Governor Josh Green. He has the distinction of not only being a political figure, but also a doctor. And so we ask him to come on and share his medical expertise and, of course, the political side as well. Good morning, Dr. Green. So how are we doing today?
We're hurting a little bit. For sure, the cases are surging. This is a legitimate surge. We have some of the highest rates of transmission right now in the country. And that's a reflection of having had so few cases before. We had very little immunity. We have, yesterday we had 118 cases. Today we have 202 cases. And we have active numbers that are growing. We have 2,256 cases active right now. Our hospitals have surged somewhat. As of yesterday, 166 people in the hospital. That's up from about 105 5 days ago. So you can see that those numbers have been tracking with the big surge that started earlier this month. You know, the big picture, and we'll talk about a lot of these things, is that we're in a large surge right now. We are preparing in every way to make sure our hospitals have the capacity to keep people alive. But we have to soften this spike. I mean, it's been going up through the roof, right? Last weekend, we did change the rules, so we hope to blunt the effect over the next few days. We'll start seeing that effect usually 6 to 8 days after. The question remains, will it be enough? Will that actually decrease the number of daily cases, which in turn will decrease the number of hospitalizations and deaths? So I think these are the things to get into. It is good that we took action. It's good that the mayors and the governor made a decision. It's probably not going to be enough. And I'll just keep giving you the numbers day by day so that everyone knows transparently what we're up against.
You know, when you're talking about sort of that lag time, we're going to take next week, we begin to see sort of the fruits of our labor, if you will. We also saw some mass testing that happened here on the island of Oahu. Are those types of numbers going to be reflected right away? Or are we seeing those numbers this week? I mean, what is the turnaround time in terms of testing and how accurate the daily counts are based on when people are getting tested?
They've been quite accurate. Today's 202 cases are a reflection of 2,726 tests. So, you know, that's math that's easily done. You can see what the rate is then. And it's just a reality now that we have more testing that's necessary. That's about as many tests as we're capable of doing in a day. The testing increase is a good thing because it gives us a better window into the reality of this virus. Of course, we also are testing some large institutions. They had the outbreak over at Honolulu Hale. Probably not a great idea to keep that open last weekend, but you know, there are going to be normal, hard decisions to make. And I don't fault anyone for making them. Those are tough calls all the time. But when you have spread like that, you have to begin to consider shutting down institutions. Institutions are a risk usually when there are more kupuna. That's the ones I worry about most. And that's when I'm kind of dreading that we ever get a large outbreak in a nursing home. But yeah, we're seeing lots of cases. We're seeing lots of testing. We're also seeing a lot of preparation and some new plans that are going into place.
Let's talk about those new plans. You alluded to that, perhaps that the parks and beaches might not be enough. What could those new plans entail?
Well, if we are here next week, Tuesday, Wednesday, Thursday, and we're still seeing 150 to 200 cases a day, that's a number that's not sustainable as far as taking care of patients 3 weeks later. It's not okay. We would not be able to keep people alive. So if we get to next Wednesday or Thursday and we're seeing this number, my advice will have to be to the governor to do the full shutdown and go back to a 4-week period of stay at home, if that's the number. The reason for that is it worked. We know that that is effective. It's extraordinarily painful to businesses, but at this rate, we're going to face that kind of necessity anyway. It's just we'll face it with fatalities. So that's what we're headed to. So everything that we can do now, the effort that we make today to not be in large groups, to not be without a mask in front of other people, to stop spreading it, the efforts we make today will be reflected 5-7 days from now, and we'll know then whether or not we can sustain where we are and decrease the rate or have to go harder lockdown. It's not what people want to hear. However, everywhere in the world, we know if you truly lock down, you can stop the virus. And we were lucky to see an example of that already working. So we don't have to kind of tilt at windmills and guess at it. We know it would work. We know what the economic pain is based on unemployment, but we would also know that we would emerge with, a better situation for our hospitals. So wait for that. I mean, I don't think it's lost on anybody. Every time we meet, I'm making clear that people understand from the leadership team where we are with the hospitals, where we are with the cases. Department of Health has done a pretty good job about that, giving us that information. Actually, I know sometimes the data seems lagged and people get freaked out, but it's a lot of data to be accumulating. It's a lot of hard work. I have other criticisms of some of the effort, but as far as the trends go, we've been able to monitor it correctly.
Talking about some of those cases and those numbers, I want to bring in a question here from Mindy, who's asking what percentage of the cases are children, and what is the recovery rate for children in Hawaii? We recognize the deaths that have happened, and a lot of them are tied to those who have other health conditions that have ultimately led to some of the struggles that they had. But what about the rate of children in terms of their cases that we're seeing and the recovery rate with them?
Well, let me start with the good news. The rate of recovery has essentially been 100%. I don't know that we've had any fatalities. I believe we've had only one significant hospitalization for a child, which is extraordinary news. It's something that we should celebrate, because I can tell you if we started seeing the multi-system organ damage that some people have seen, there have been about 500 cases nationally where children have had the inflammatory response to the virus and ended up in the hospital with terrible consequences. Not only would it break our hearts, but we would then have no recourse but to shut down schools indefinitely. We would have no recourse but to shut down society, because I know what the response would be psychologically. As to the number of cases, the percentage of cases, I don't have a number off the top of my head. I know that once we started testing more widely, we did see a spike up to 15-20% of cases on some days that were children, but I don't track exactly every test. It's different every day. Sometimes we're at Honolulu Hale and you add an extra 1,000 tests, and none of them were children, obviously. On regular days when we're out in the community, you're seeing a good sampling of people under 20. That's the category that we've described as children, minors, basically.
Let's bring in Kristen's question here. Kirsten Snook says, is the Hawaii Department of Health planning on increasing contact tracing capability? There's an article in the paper today which has some of the comments you made yesterday. You, along with Tulsi Gabbard and some others, have been somewhat critical of the Department of Health and the contact tracing capabilities. Where do we stand on that, and what do we need right now?
So yes, there's good news there. They are ramping up very significantly. They have some new leadership that's being applied to that, because the job is just simply too large for a pair of individuals or a small cohort. And that's not a knock really on Director Anderson or Dr. Park. It's just too large. This is a statewide cataclysmic situation, and you have to have so much help for people. So a good decision was made to bring on some additional help. Their team is being built out. I'm hearing that they're going up to 200 people fairly quickly. I also believe that they're going to have a center. We'll be meeting later today or early tomorrow morning to go over some of the details. But to produce a center like that, a place where people can not only do it professionally, full-time, we need full-time workers, and we need more than just 200, but that's a big improvement. We also need to have the capacity for volunteers from around the state to participate and help out if they ask. A lot of healthcare providers, professionals, some retired, with a lot of training, could offer some extra support. I know that it was dismissed by Dr. Park as a nuisance to have volunteers, but that is just insane. You have so much need. There are some countries, for example, this will sound a little odd, but Thailand, for instance, Thailand used up to 1 million additional personnel to do some contact tracing, outreach in villages, community health workers, village health workers to contain their virus. That is an amazing effort. Basically, that was the truest definition of all hands on deck to help. And now I'm not asking for 100,000 workers. I'm asking for a couple thousand people to be able, when they have time, to contribute. Also, we are going to use the National Guard to support the contact tracing effort. So this is the strategy at the moment. We're putting in some increases in restrictions, right? So restrictions meant to bring the numbers down gradually. If we have to bring them down precipitously because they're so nasty, then we'll do like this, right? We'll come over the cliff. Meanwhile, Department of Health has to ramp up their tracing and testing capabilities, and that's very important. So the tracing, critical, because you have to get people in the mindset that you will stay home if you've been contacted, if you're a close contact. You will spend 2 weeks at home. We will test you also to know whether or not we have to worry about you as a case and all of your contacts, but that's necessary. And hopefully this intersection over the next 2 to 4 weeks will make a huge difference, because if it doesn't, my goodness, I actually did not expect us to reach a place where we were looking at 3,000 to 4,000 cases in a month. That was unforeseen and pretty incredible to imagine, but that's what the explosion of July 4th and a few bad decisions of large gatherings on street fairs and stuff will do to you. That's what happens when you do that. And I know people don't like to hear the harsh reality right in their face sometimes, but that's my job, really. Try to keep people alive and to tell you best that I can tell what will keep people safe. And criticizing Department of Health a little bit is necessary so that we can improve and celebrate the good things they've done and not do colossally stupid things like getting a lot of people together at the same time in the same place. That has to stop. And that's how you beat the virus.
We're getting some comments about some of the statements that you have made about the Department of Health publicly. We're just wondering, what are sort of those conversations like with them outside of the media? Because we're assuming that you folks are meeting regularly and are having these briefings with the Department of Health. I'm assuming with the task force that you mentioned earlier. But are those types of discussions happening behind closed doors with them? And what does that look like when you guys are meeting as a team, and how often is that?
Oh, it's warm and loving at all times. I mean, look, there are some moments when if I have to be stern and upset on behalf of people, that's okay. But, I have a lot of respect for Bruce. We do disagree on some things. That job is too large for one person. That's a 5-person job right now. And you got one director. When I have meetings with, the top people, sometimes they're very quiet and we just work quietly through challenges. Everyone knows that we have to do more. And we were doing pretty darn great in May when it was down to nothing, when we had, of course, locked down the entire state. But you can't rest on this, and you have to constantly bring in reinforcements. Think of it like a sporting team where you have to bring people off the bench periodically when your people get jacked up or when they are exhausted or when you have to adjust to a new defense. That's what you have to do. Forgive all the sports metaphors. We got Blangiardi and Amamiya, 2 jocks running for mayor, so I guess I had to bring those things out for you. But that's what basically has to be done. And sometimes your starting team has done well for a while, and then they have a broken leg, and they need to get some help. And sometimes they just need to rest. But this is what's necessary. And so I've already had several meetings just this morning, starting usually at 6 a.m., to put some individual helpful supportive pieces in place. And the Department of Health deserves more support. They need to use the resources, of course, that they have. There are lots of things we could talk about. They have to have that tracing and testing center. They also are expanding their capacity to have more beds for people if they have been in the PI community, the Pacific Islander community, and they're at risk. We have to have capacity for our long-term care patients. That's being worked on very aggressively with a good set of healthcare leaders and the ESF8 and health team. We have to be able to ramp up our testing. That's being worked on through Department of Transportation, interestingly, because there's some resources there. And then, of course, the lab people. But you can see how large the job order is, so to speak, for all of the Department of Health. And we had a couple choke points. We had Dr. Park, who is a very good epidemiologist, but cannot handle all of those things. It's unfair to expect that. And so when people comment, I don't get to see the comments. You're probably trying to keep me from getting mad, but The point is, we need to help those folks. We only had about 15 investigators working full time at the Department of Health. There were a few people spread out across the state. There were some public health nurses doing a couple cases here and there, but that's just not enough. You got 2,000 active cases. So every state's experiencing this. I was on the phone with New York today talking about what they're experiencing. I have other lieutenant governor and governor colleagues that have shared information. And then there's all the health people in the world that we're communicating with. And it's a global pandemic. It's not a pandemic for Hawaii. It's a global response. And that's why we have to wait to see what happens in the mainland before we open up again. And we have to learn lessons from other places that are opening schools, whether they open society, how much testing and tracing they did, all those things. And that's why you want a team. You don't want just one or two people making decisions, which was one of the mistakes that we made for some time.
Let's go to Heather's question, Ryan. The timestamp is around 10:33. She says, what is the ultimate goal, Dr. Green? Is it to flatten the curve or total eradication? I think this is a really good question. Actually, it's before this one, but that's fine. That one, 10:33. Yeah, so are we trying to flatten the curve? Are we going for total eradication? How do we know when we're successful?
So it's to flatten the curve and to get the number of cases to a place where they will not, as there is still some spread every day, they will not overwhelm our healthcare system. That's the goal. You get to that place where it's manageable, where we can actually trace and test all the cases we need and account for all of the care we have to deliver at the hospitals. You get there, then you can open up schools, you can open up the trans-Pacific travel, you can do a lot of things. Eradication of the disease will only happen probably 4 to 6 months after a vaccination has been fully globalized. And that's going to take a while. We probably will get a vaccination sometime between December and the spring. We don't know when. The Russians say they have a vaccination. That's because they're bypassing a lot of the phase 3 trials and testing, which makes it risky. But that's what happens with these things. People get panicked and they rush and they try to get ahead. Sometimes it works, sometimes it fails badly. That's when you get eradication. And also when you get some global immunity, when you get herd immunity in other parts of the world, gradually the cases come down. The virus has nowhere to go. The virus is trying to cling onto new patients at all times and spread and spread and spread. It doesn't want to kill patients, it wants to spread. That's how you look at these viruses. And once you've immunized 40, then 60, then 80% of the population, if you get there, or if they get immunity, it finally drops off and dies. That's when we'll get there. But as soon as we get down back into the lower numbers, like 30s, 40s, even lower than that, then we know we can manage, like we have for many months, the hospital load. It's a little disconcerting, though, right now, because we went up about 60% as far as our hospitalizations, 50, 60% just over the last week. And we are now facing a backlog of 2,000 cases. And let me break that down for how this works out. When you had 100 cases total out there over the course of 14 days, very small numbers, only 10 or 11 people, it's 11%, have gone on to the hospital. And only 2 of those people end up in the ICU. That's why our numbers stayed so low for so long. Now, over the last 14 days, you've got 2,000 cases that are accumulated. 2,000 cases times 11% is about 230, 240 people that will end up in the hospital. And that's 40 people that will end up in the ICU. Potentially half of those people can die. So these numbers, as they accumulate, become worse, and they also stress the health system. And worse still than that, if you overwhelm any one hospital, you may not be able to give all the people the care that they deserve. So that's why all of these things come back to the response and the numbers. And we can get those numbers back down per the question that was asked. I know this is a long answer, but this is really the centerpiece of the whole thing. If we get back down to 30 cases a day, that means over the course of a 2-week period, 30 times 14 is like 450, 500 cases. And that 11% is just 50 people going into the hospital, and it's very manageable. You still could have some fatalities. Hopefully they're very rare, but it's way more, it's way more of a response that can be handled. And so we have to get back there.
And to expand upon that question and bringing Pua's question in, but this is counting on that with these restrictions in place. And so let's say we get back down to those 30s and 40s. Would those cases, in this point, she's saying, increase once again, because we're going to be opening up again, and we're going to kind of be going through this same cycle and repeating this cycle here. As we reopen, we get more positive cases, and then we'd have to shut down again. I mean, what is sort of that ultimate goal in order to sustain those numbers that you speak of without necessarily shutting everything down every time we do that?
A couple things. We have to be somewhat less stupid the next time. So we don't open up for big activities. We don't allow large beach gatherings. Maybe some restrictions have to stay in place. For example, it was perfectly good to go to exercise at the beach, walk with your significant other, go into the water. But as soon as you started having gatherings of 20 people next to 40 people next to 50 people, and then you're jumping off Waimea Rock, you're doomed. You're doomed to large spread. Other things have been now clearly discerned as risks. Funeral services among populations that don't fully grasp the need for mask wearing because we didn't communicate adequately in a culturally smart way to the Pacific Islander community. Those that were in the Pacific Islander community who were having funerals, having large kava services, 30, 40, 50 people, the spread was rampant. You were seeing 50% rate of spread in some cases. So when we go back after getting the numbers under control, you don't do that. When you have funeral services, you only have 10 people at a time. We have the large outstanding questions. We got to get the school openings right. It's going to be difficult to open schools correctly without any evidence of what the best practice is. That's why probably the most conservative road has to be taken, and we'll see how that unfolds in the next couple days. I am fairly certain that the community of parents, teachers, and the teachers union are too worried that the spread will not be containable. And the last thing we want to do is add a whole nother variable into a surge. That won't work. We have to get through this surge before we can even dream about putting kids back in the classroom, if I'm just being blunt, okay? So those are the things that what I think her name was Pua was asking about. So when you go back, first of all, you don't go back full in, but you still can have restaurants open. Maybe you can even bring back some things that you lost, like bars or exercise classes if you do it smart and right, but you can't do large gatherings. And if that's the approach you take, then the spread again is very minimal. The cases stay low. I don't think we're actually going to get a lot of travel, interestingly, when it's cases from travel. I don't think that's going to be the crisis. We'll have to be mindful of that, and I know people are concerned, so we'll make sure we do that right to the best of our ability. But really, it's the large gatherings. It's the unmasked large gatherings, particularly in closed spaces, that get you. We've also seen that closed spaces are much more infectious environments.
Well, closed spaces are by definition schools. And Tom asks, will schools be able to return to full-time in-class learning anytime this year? What's your take? I mean, I know you don't have a crystal ball, but for parents out there who are trying to plan and trying to prepare, when you see what the other viewer was responding to in terms of opening and closing and opening and closing, if you have a job, obviously, and you have school-age children, you cannot do that. So should parents be sort of, as they plan for the months ahead, should they be thinking this is going to be permanent distance learning, at least for the next few months?
I think it's pretty safe to say that distance learning is going to be the rule through the first quarter. I don't personally see how before the first quarter ends that we're going to get out of distance learning. That first quarter for the public schools ends, I believe, October 2nd, and they go back then after fall break about the 12th. Just looking at the numbers and being a realist, I would be shocked if we get to anything other than distance learning for that first quarter. It may very well be the most sensible thing if we continue at rates like this. If the rates are like this, then it will be the rest of this calendar year. And we have to be mindful that teachers have children. A lot of our teachers have children at home also. So putting the teachers in the classroom will also be problematic because we have to take care of our keiki. It may very well be that we have to commit ourselves to distance learning for the whole first half of this year through January. By that time, a lot of good things will have happened. We will have some capacity, some capacity to have a vaccination. We certainly will have learned through 2 or 3 cycles of lessons the way to stop the darn virus. And we'll know what we can and can't tolerate. We've already proven a couple things. Let's go with what we know, okay? We know that the home isolation order that the governor made at the end of March worked to kill the virus. We know that. We had, after that effect, a flat month. even though we had a trickle of individuals traveling in, say an average of 400 or 500 people a day, and some of them were jerks and they went and flaunted the rules and went on social media. But that number of people coming in was so low as far as viral load that it did not cause any kind of spike whatsoever. Not even a ripple at the hospitals, not a ripple in the numbers. I remember our curve for the month of May, it was like straight flat. It was flat line, okay? Which is good. So we know that that works. What else do we know that works? We know masks work because a lot of countries are using just masks religiously, and they've kept their numbers down if they've socially distanced and contact traced aggressively. We know that works. What do we not know? We do not know what the effects of opening schools open to a lot of kids are. We don't know that. So that's a variable that we should put on the side. We also don't know what happens in an American society that will always behave somewhat more individualistically than some of the Asian societies. We don't know if you can ultimately even convince people without a full lockdown order to not gather. That's why the lockdown orders may be necessary if you really want to stamp out the virus again for a month.
Another question, of course, that many are wondering about is the September 1st deadline that was sort of put in place for the reopening of Hawaii. We realistically know that's not happening based on everything that we're getting in information. But what steps are being taken now so that when we get to that point, let's say, where we can reopen the state, that we are ready to go at that point? I mean, we know that you've been talking for a few months now about the partnership with CVS and with Walgreens that you've been setting up and working on. Are those types of things already in place and it's just a matter of getting the countdown now? Like, are those things locked in and that whole procedure sort of worked itself out?
Yes, so that's ready to go. So once we have an actual date, we have them flip the switch on 72 hours before. And so that will be fine. And right now it might be difficult to get a test, but people will know that they'll have to get a test to come to Hawaii. There's a constant conversation going on also whether any other tests are going to be allowed, some of the more rapid tests. That's a discussion that is very good. Excellent people at Department of Health working on that. So that's another good thing. So if some of those tests become available or acceptable, those are the nucleic acid amplification tests, also called NAAT tests. They include the PCR test, the one that's terrible in your nose, but also the other tests that are like the saliva swabs. That would be great. So that's all set. Then we have Ford doing extraordinary work at the airports to prepare for the inevitable delays at the airport when we have to get extra information as people come in. We also are setting up a process whereby if people come in and they refuse to go into a testing situation where they've been ruled out, then they will have to hopefully go to a quarantine facility. And that hasn't been finalized yet. That's a policy call that has been put out a little bit, but that is one way to really do it. If you really want to have significant travel come back to Hawaii, knowing that all of these people are negative, fantastic, and these people who refuse a test, sorry, you're going to be at a quarantine hotel, for lack of a better description. That will contain it because you could actually enforce that. So all those things are really ready for go. But the question remains is, what's the date? Because we're already going through September 5th with our Act with Care, no gatherings, I guess is about as clunky as a description as you could possibly dream up. But let's just say don't gather, okay? The don't gather rule. So we get through September 5th. Really, we should at least extend that past Labor Day so we don't have another explosion of cases like we had July 4th, okay? Guys, let's just expect that. If we have any brains at all, we'll do that, okay? So we go past Labor Day and we see what the numbers look like. I can't imagine that we will try to inject tourism on September 1st in advance of Labor Day when all of that's going on still. So that's the first big picture. Meanwhile, schools are scheduled for later in September. It's really going to play out, a lot of it tomorrow. I understand that the union and the parents are together to talk about this. There's going to be a panel, I believe, on Hawaii News Now, which I'm participating in with some other doctors, Dr. Nadine Tensala, and some officials from the Department of Education to talk about what the risks are to kids. Pretty low to children, but pretty high to their parents and their kapuna afterwards. So that discussion happens, and I think you're looking at a calendar. If I can give you broad strokes, this is not policy. This is what it looks like from a reality standpoint. You get past Labor Day without a calamity. The hospitals are settling down a little bit. Your tracing is good. The schools realize that the first quarter is lost. You do education from home, and then you begin tourism once you're set. And so that's the way it basically looks like to me. Meanwhile, some good things can happen. The bubbles could begin. Travel could begin from Japan if they choose to come here in mass as a culture and as people that have loved Hawaii because it's very safe still. If we get other people that want to do bubbles and they go through testing and good safety protocols, I think that could definitely give us some economic activity. And as long as we're not in a huge surge, we can continue to have our own economy going, restaurants, shops, and so on.
Will Lee brings up a point here. We talked about the school piece, but he says, doesn't make sense that DOE would be online all quarter, but private schools have in-class instruction. This should be done as a community with consistent practices across the board. I want to also wrap in, along with private schools there, daycares, because that's obviously something that's stayed open throughout. So has the state thought about putting any mandates on private institutions? Because some of those folks are going back for in-class instructions.
It's a great question. There's only so many controls you can put on the private sector. Of course, you can close private bars. You can close or consider making closure recommendations for private schools. I have one kid in private school, one kid in public school, okay? The difference is that the private school has about 3 times as much resource as the public school per pupil. And the private school has a very different relationship with its educators. So they can have a dialogue that is not fraught with some of the, the challenging political landscapes that exist. From a safety standpoint, if the private schools feel that they can socially distance their students and they have the resources to provide testing and tracing and masks, and their teachers want to teach, I don't personally see a problem, because I do think that they can much better control it for Maya, my 13-year-old, than what the public schools have the capacity to do, where they have far less resource and they put the public workforce in great peril. And that is a different dialogue and a different discussion. For simplicity, there are some times where just a simple approach for all makes some sense. That's why ultimately we had to shut down the parks and beaches again, because though you could have done it with a scalpel, the scalpel wasn't really working, and you had to come over everyone's head with a sledgehammer to get them to stop spreading the disease if they were young for a time. No, that's not meant to be a Representative Brower reference. I'm talking about sledgehammers against this virus, okay? So you sometimes have to do that, and that's a way to keep people alive, But the private schools, they have so much more capacity to do this. Now, even our private school, the one that Maya goes to, as opposed to Sam's public school, they are delaying. They're waiting quite a long time. And I still don't know for sure that they're not going to do distance learning all the way through the first quarter and beyond. They've actually put together some protocols which are in every way more expansive than the Department of Health protocols at their own school. I mean, they're applying the principles of tracing and testing and social distancing with a better standard than our Department of Health came up with. So, that's what happens when when you got a small, I'm speaking about Iolani now, by the way. Okay. So that school does something pretty special, and they all do something good. Our charter school would love to do all of those things, but they don't have millions and millions of dollars extra to potentially put into the effort. And that's why the challenges sometimes remain separate. But our kids are going to be happy this fall. It's just they're not going to be quite as happy as they used to.
Well, to that point, and I know you have to go soon, but Sherilyn Maciel, I mean, it's sort of a larger point about the economics and class issues in our state, but she says, so basically people with money can continue to have a more normal educational experience for their children. It does raise some issues if you have a certain sector and class of people who can afford to send their kids to school and have the kind of resources you're talking about. I mean, these are just the realities that public schools don't have the same resources, but I think that there are a lot of parents who are going to be pretty upset about that.
Well, tragically, the whole world works like that. I mean, I sent my kids to public school because we couldn't afford it through 6th grade. And we can afford one child in public school, one child in private school. And our public school education has been rock solid star quality. But sometimes you choose one thing for your child and something else at a different time. Some people put extra resources into their health Some people decided to invest in an extra room or rent a separate apartment, even at great hardship. But there have always been inequities, and we're seeing that mostly play out in the inequities in the Pacific Islander community, really. If you want to talk about where disparities occur, right now it's among the Pacific Islander community that has 4% of the population, but 30% of the cases. So there are disparities at the education level, at the economic level, and certainly at the housing level. That's a very big challenge. We have some people that can only afford a small apartment, and they might have 8 or 10 relatives with them. So they are at increased risk. Yet there's not really a practical way to put all of the people of Hawaii into hotels that are clustered. So we're talking, and I do really appreciate the comment, we're talking about greater social inequities. And one of the things that I feel strongly about, and I won't get into this too long because it could take us hours, is I feel everyone deserves affordable housing, and we should have no homelessness in our state. And those kind of considerations need to be addressed, and I'll address them in the coming decade. But I'm telling you now, it's too fast to do during the COVID crisis. If we want to be fair to everybody, for sure, we will lean on all of the different ways to educate people and fight for extra iPads and distance learning and technologies and access to Wi-Fi for every kid. But these are problems, unfortunately, that when I was in public school back in the 80s, we faced that too. We always looked at the private school and thought, man, how incredible their fields were and how amazing it was that they had all these extra AP classes and so on. But we did okay coming out of public school. We kicked the crap out of them in most sports.
To kind of sort of wrap things up and steer it back to the pandemic as a whole, you talked about the Pacific Islander population. Maybe what are some of your thoughts on how does that resolve itself? I mean, what is being done to sort of make sure that that information is being reached to that community? And then the other community was talked about by Dr. Anderson, is about reaching the millennials, the younger generations who are seemingly not obeying some of these orders, are still gathering, finding areas. Not me, but how do you reach them, and what realistically in these two segments of population, what is the most realistic approach to making sure that they are being part of this effort?
I'm just teasing you. You just look like a millennial. Feel like a millennial. Okay, there's a couple things. Right now, in fact, today, the Pacific Islander leadership is meeting with some of the leadership of the Director of Health's office and Department of Health, I believe. They're certainly been meeting with me, and I was very glad to see that they met with the mayor of Honolulu. They need a lot more resources. I've given several ideas and plans directly to our health leadership. Number one, they have to have some housing capacity expanded, so they need to be into where there's high clusters and individuals living in very dense households or part of the community that have been affected. We do need some hotel rooms immediately for individuals to especially separate positive cases from large family gatherings. There needs to be some resource put in place for those who can't work. There's a lot of poverty in the community, and so we have to make sure that we get disability or extra unemployment processing in place right away if people are going to otherwise become destitute, because you could get housing insecurity really fast, and we don't want more homelessness. Definitely bringing more PPE. Our team actually donates a fair amount of PPE whenever we get it, specifically to that category of individuals in need, Pacific Islander community, where the need is greatest. All of these things have to happen in real time. We're talking about some transportation also, some extra shuttles and transport away from households into housing immediately. There's got to be better language communication. We've asked that the community health centers be engaged and they get to use their clinical health workers. That category of healthcare workers can be contact tracers directly added to the cause. They usually are of the exact same ethnicity, and that's a big benefit. All of those things are part of the plan that we gave and handed over to Department of Health, and they're hearing it right in their face in a good way from the leadership, like Dr. Palafox and the few others that are really kind of hooked in. They're right locked in on that problem. So it's doable. It's very doable, but it speaks to the previous question, which is when people have less economic capacity or political influence, they always get less. And it's not acceptable ever from a standpoint of human lives. And it's even particularly worse right now because you have the collateral damage that it also causes. When you see a community that gets overwhelmed by an infectious disease and then ends up needing to overwhelm a facility or a part of the healthcare system, it affects all people, not just the tragic sufferers of the disease in the Pacific Islander community, but also then it could be the Samoan community. It could be, frankly, if you overwhelm Queens Hospital and or Hawaii Pacific Health, we all suffer, because if you needed that service, it's just not available to you. And we're seeing that actually in real time right now, where one community who suffers socioeconomic disadvantage, now their disadvantages get translated to exhausted healthcare workers. It gets translated to less beds that are available. It gets translated into more spread. So all of these things are very real. It's an example like we've rarely seen of the impact of connectedness. And right now, everybody in Hawaii is connected by, in some cases, the most dangerous common denominator, which is rapid spread in urban communities. The only people that are being spared right now, in fairness, are the neighbor islanders, where there's very few cases. And that's always right on the edge, right? There hasn't been significant spread on the neighbor island front, but that's why they came in with the 14-day quarantine and travel quarantine again. But with the exception of the neighbor islands, no one's been spared on Oahu. And as hospitals fill up, you'll see the effects in all other communities here on the island. So I think it's time everyone sees the big picture. And I hope that this, I don't mean to say things in a provocative way. I'm trying to just make sure that everyone sees a real picture of what COVID is. There are ways that this thing could go and take us into a hellacious spot, and there are ways that we could actually defeat it quite well. I didn't touch on millennials. It really is probably going to be necessary to up our game on communication with the millennial community, and they're just communicating in slightly different ways, and it's very natural for individuals always, if they're not significantly affected personally in any group, to not take things quite as seriously. But what individuals, if they're listening today, or if they get a clip of this broadcast, if they're in the millennial community, what they should realize is, though they themselves may not suffer the physical consequences or the health consequences of a lot of spread, the business community and the economy will stay closed as long as we have high cases, and they will be unemployed. They will not be able to afford housing. They will not be able to afford cars. They will not be able to afford their education because they will not be able to go back to work. And they may kill their grandparents. So the combo of those things should be enough to kind of chill and not spread the virus for a month. But it is difficult, and as a physician for more than 2 decades, it's always been difficult to convey to people who are younger that their behavior today is going to have consequences later. Because if I tell someone with high blood pressure when they're 31 years old they've got to stop eating burgers, they just don't listen. But if you tell somebody that their actions today are affecting all the people around them, I think then a lot of times you get more responsible behavior.
Okay, so for those folks who are just who have joined us late, this will be the last question because I know we've gone way over time. But just to reemphasize, if we see these numbers continue by next Wednesday or so, we are going into another lockdown.
I would say that is right. That will certainly be my recommendation, and so it's really up to everybody this weekend, the rest of this week and this weekend, to do all that we can to prevent spread, to mask up, to socially distance, and to not go to any significant gatherings. We're watching the hospitals very closely, and as I see the surge at the hospitals, I'm preparing behind the scenes to make sure that we have extra capacity ready in case that it's too much. And before we go, can I make one personal statement? Is that okay?
Yes,
of course.
definitely.
Okay. Yeah, I wanted to those who are listening to say something totally off topic. I wanted to send my love to the Radcliffe family. John Radcliffe was very dear to me, and he passed away last night after 6 years of fighting colon cancer. And John fought for the physician-assisted suicide bill, which may have been controversial, but he died peacefully last night after making a decision to go peacefully. And so I wanted to say goodbye to John, and that people are going to be okay, but be safe out there.
All right, Lieutenant Governor Josh Green, thank you so much for spending some extra time with us, and definitely agree. John Radcliffe, a staple at the Hawaii State Capitol, and not only that particular bill you talked about, but so many other key pieces of legislation that has gone through the legislature over his time, and certainly someone who will be missed. So we thank you very much for your time and for all the hard work you're doing. Mahalo.
Thanks. Take care.
Thank you. Wow, some sobering information there from Lieutenant Governor. If you missed the top of the broadcast, we invite you to go back as soon as we're done live streaming. You can go back and watch this conversation in its entirety. There's a lot of important information about contact tracing. Cases today, he said 202 cases today. Over 2,000 tested. So the rate there is not good. It's not what we want to see. And a pretty sobering warning to all of us that if things don't change in the next week, we are talking about 4 more weeks of the kind of lockdown that we saw in March, which would be, as we know, devastating to local business.
Yeah, and then really that's the question that I know the businesses that we have that we've been featuring and talking about during this time are really worried about is how do they even survive during yet another shutdown, especially since some of these unemployment benefits have sort of expired. We're still waiting on Congress to pass another relief package and get things settled on that end. And so there's still a lot of questions, and certainly no one wants to end up going back into that phase. But as the Lieutenant Governor said, there may just be no other choice but to head back there because of the impact that it's going to be having on the hospitals and the significant impact that they are already seeing. And so those numbers on Monday and Tuesday of next week are going to be very important to monitor and watch and to see where we stand during that time, and if that will indeed trigger another lockdown that, as he said, could potentially last through Labor Day. And Yanji, we began this conversation and this show back in March, and it's hard to believe that we would even be considering going back into another lockdown and talking about extending it through Labor Day.
Yeah, I mean, this not only affects, of course, schools and businesses, it'll affect the well-being of our community, because I know so many people were so anxious during that time. If you think back to how people actually felt on the ground in March and April, and there was sort of this period where we thought, okay, this is temporary, we can do this. People were, trying to navigate the unemployment system and all of that, and thinking about going back to that is really, really disheartening. So we hope that everyone really takes those words to heart and does practice the social distancing, the mask wearing, and all of the things that the Lieutenant Governor emphasized. He did say that they are trying to stand up a larger contact tracing operation, so that is reassuring. About 200 people. We don't know exactly where they're going to do that. My understanding is that the convention center is a possible location for all of those folks to be working, and then also possibly bringing in more volunteers, perhaps people in the healthcare industry who have extra time on their hands, maybe they're retired, that they could come and help as well, because that's obviously something that is lacking. He was critical of Dr. Anderson and Dr. Park, but measured in his criticism, not wanting to pile on too much this morning.
Yeah, and saying that just the bottom line is this is just too much for anyone to take on. The number of issues and things that sort of both of these individuals are having to tackle during this time for this extended amount of time is just more than anyone should have to bear. And so he mentioned that there will be a dedicated leader, so to speak, for those contact tracers to report to directly and sort of oversee just that management of that. And so we'll wait to see what sort of information we get from the Department of Health and from the administration about those efforts that are being made to sort of change the processing of this at the Department of Health. But still, a lot of I know we're getting so many questions that are still coming in, a lot more questions, and we'll have to wait and see what things look like again next week.
Yeah, and we know now from talking to him, and it's pretty obvious with the case numbers, that September 1st is definitely not going to be the day for Trans-Pacific travel. We don't know when that will be, but at the end of this month, we've got some great guests coming up, and toward the end of the month, we will have Peter Ingram from Hawaiian Airlines along with Governor David Ige, so we'll definitely be asking those folks then. Starting on Monday, we're going to be talking to Sherry McNamara from the Chamber of Commerce to talk about what local businesses are going through. A lot of them shut down temporarily. How many of those shutdowns could be permanent, and what will Hawaii look like, the economic landscape as we proceed out of this, or rather through it?
Yeah, and we are still making an effort to reach out to Mayor Kirk Caldwell. We were originally supposed to have him on Monday. We may have a special edition of the show. We are here every Monday and Wednesday, but to accommodate his schedule, we are working to sort of get him back on this platform because we know that there are many people out there with questions directly about some of these lockdown and these new rules that have been put in place and would like to ask those questions to the mayor directly. So we will keep you posted. And of course, stay connected to the platforms of the Honolulu Star-Advertiser for those updates. And we will let you know if we are able to secure the mayor on the show at those date and times, or if there's an additional time. But again, we thank you for tuning in. We thank you for the many questions that have come in. And of course, we thank the Office of Elections for continuing and allowing us to have this conversation, who have brought to you this program. Again, remember, the primary is done, but the general is still coming. And we'll continue to provide you more information about the general election and those candidates coming up in the weeks and months ahead. So until next week, Monday, we will bid you a fond aloha and mahalo for watching.
Stay safe out there.
Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii Elections Guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.